So our study was really looking at the outcomes of treatment of patients with wet macular degeneration with anti-VEGF therapy. And what we found was that patients who initially presented with good initial baseline visual acuity tended to do the best in terms of their final visual outcome. So really what this means for the primary care physician is that if they know of patients in their practice who have macular degeneration, to really counsel them to look for changes in their vision. And the moment that a patient detects or feels that their vision may be declining, that would be the time to make a referral to a general ophthalmologist or to a retina specialist. Because really the take home was that the earlier that we can diagnose wet macular degeneration and confirm the diagnosis and institute treatment, that the more likely we are to hold on to the patient's vision. And that was what was shown through the course of the long-term follow-up of our study. So the patients with good initial visual acuity didn't gain as much vision because they already started they entered at a point where they had good baseline vision, but the good news is that those patients were able to hold on to that vision and end up with final better visual outcomes. On the other hand, patients who had poor vision going in tended to gain more vision, but at the end of the day they actually still had poor final visual acuity levels compared to those who initially had good vision. So that again just reiterates the importance of early detection and treatment of patients with macular degeneration.